Alright, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. We examined your shoulder before we started, and your shoulder would dislocate both in the anterior and posterior direction, which is what we knew from your exam in the office and what we suspected we would confirm. So now we're just looking in from the back to the front. You're laying on your side, so the ball part of the ball and socket joint's at the top of the screen, and this is the glenoid or the socket part down below. If you were standing up and we were just standing behind you, it would look like this. The socket on the left and the ball coming off on the right, which of course is your right shoulder. But since we operate with you laying on your side and your arm up in the air, everything rotates like that. So now we'll just get a start looking at the anatomy. The biceps tendon here runs up between 6 o'clock and 12 o'clock on the screen on the left side of that clear cannula. We'll look down at the biceps anchor, and as we look at the biceps anchor, this actually looks good. There's really no signs of any significant injury. This part of the shoulder, if there's an injury or a tear or a detachment, we call it a slap lesion, and you do not have that. Okay? We'll look towards the back of the shoulder, and we can confirm that you have a shoulder that, for all the world, looks like it's got loose capsular ligaments, because we can see all the way around the back of the shoulder. We can see the inferior recess. We don't see any significant or well-defined inferior glenohumeral ligament. And when we look at your glenoid, you can see there how it looks like an island just sitting in the middle of the joint, because the joint capsule's attachment is well medial on the glenoid, and it's just not well defined. So we're going to get to work tightening this up. Just remember how this looks right now, because it'll look very different in about 30 to 45 minutes once we tighten up the ligaments. As you look down the front, this is the middle glenohumeral ligament right here, so you can see that. The anterior band of the inferior is right here, and although we can see it, we're going to make that a little tighter to help support the shoulder. So the first thing that we do, well, let me comment on one more thing. The rotator cuff at the left looks pretty good here. We don't need to move the cannula, so I can use it as a pointer. Here's the rotator cuff on the left side of the third cannula, and there's just some minimal undersurface fraying. Appreciate them? But as we probe it, it's attached to the humerus, and that's not going to be an issue. So we're going to go off on the video. We'll show you some more in just a little bit. Okay, so now we're looking from the front to the back. And we're going to back up here a little bit. I'm going to slip around the biceps tendon with the scope. So here you can see we've got this blue cannula coming in the back of your shoulder. This is called a dry dock. Through the cannula, we're going to place this instrument, which is a rasp, and we're going to use this just to roughen up the labrum a little bit. We're not going to further detach this, but we are going to try and place an anchor in right about at the tip of that instrument, right about there. And we're going to try and tighten up the inferior band, or the posterior band of the inferior glenohumeral ligament. So that's why we're using this rasp here, just to be able to do that. Try and create a healing response. Now, see a little bit of undersurface fraying of the capsule here, really, but that's not going to be a clinical problem. So the next step is to take a spinal needle and find a good angle to insert our anchor. So here you can see our needle is coming in. And we could place an anchor in right about here. That looks good. Our drill guide coming in, and we're going to place the drill right about here. After placing the anchor, it looks like this. This gives us two sutures to work with. Very solid. And now we're going to take one of the sutures out from the take one of the sutures out from the anterior portal. And so that means just reaching in here, taking one of these sutures. Pass this suture basically up. This is okay right there. And so now we have the suture coming out the back. We're going to take our turn to the left suture hook and our grasper next. Okay, so here's our suture hook. It's loaded with a black wire called a super shuttle. We'll start here. We're going to rotate back. We're going to go into the capsule right here. Okay, so here we are with the tip of our needle coming through. We'll feed that relay. Okay, so here you can see we now have the wire going through the capsule, through the ligament, and then coming out this anterior great cannula. We're going to load that black wire with the blue and white suture. And as we pull slowly back, that gives us a stitch that goes underneath the labrum there. So we're going to tie that stitch in just a minute here. We have lots of stitch options. Sometimes you use mattress sutures here, but in looking at your anatomy, we're going to tie this as a simple stitch, which means that we're going to get the other limb of the suture right now, and that gives us this loop that we can tie to stabilize the shoulder, at least start to stabilize the shoulder just like that. So as we start to tie this knot, I just wanted to run the video and show you how this starts to tighten things up here. We're going to be placing a second anchor back here because you need it. So I'll show you that too, but we're not quite done tying this first knot. This is basically like tying your tennis shoes through a straw here. We're just using this metal tube that you see called a knot pusher. It pushes down see how it pushes down the half hitches there? And then we can tie these nice square knots. So that's looking good. We're going to do one more half hitch, and then we're going to cut the suture tails here. Okay, so we'll cut the suture tails and show you some more in just a minute. Okay. So that's the first stitch. That's already starting to tighten things up back here. Here we're going to place our second anchor right about here. Okay, so there's the second anchor. You can see the location there. We can then achieve the suture out the front again. So now, you see on the screen where the suture's coming out the front, and we're ready to make another pass with our turn to the left suture hook. Here it is coming in. You always place the hook exactly where we'd like the tip to come out, which is right there. And then we rotate back, and we'll go into the capsule right about here. wire coming through. We're going to load it. And now we're ready to get the part of the suture here, crochet hook. And that's going to give us a second knot right there. You can see how this is tightening up the capsule back there. Tied the second one, you can see now, see the crochet please. You can see now that we've got a posterior band of the IGL reconstructed. This band along here is now a lot tighter, and we've closed down the capsular volume. It's still a little bit loose up here, but this is just the way you're built. And I don't think I need to place another anchor. If I did, it would have to go right about here. And I don't think we need to do that. The primary direction of your instability was anterior, although obviously you did have some posterior damage here to the labrum. Now we're looking down the front of the shoulder. This is the anterior band of the infraglenohumeral ligament. I'm just using this same rasp to just roughen up the capsule a little bit again to create a healing response. Now we're going to plan on placing at least 1 or 2 suture anchors in the front here. Anchor in position. We're going to use this one to try and tighten the infraglenohumeral ligament even a little bit more. So we're going to reach in and take one of the sutures out the back, like that. We'll take a grasper in the back, and we'll take a turn to the right suture hook now. Here's our hook. We're going to rotate back. We're going to take a stitch through the IGL here. Can't use that to plicate this. Here we are coming underneath. Here as you pull back, you can see how that suture comes through. And it gives us a nice stitch right there. So there's the first one tied. That one's good. Again, we put that right through the infraglenohumeral ligament on purpose. Here's our 2 sutures in the back, and now we're going to place another anchor a little bit superior to the first one here in the front. Okay, I just want to show you how we drill that. We'll go back, and then through that drill guide we'll place our suture anchor. You can just see it slide down there. We just tap that down into the bone with a mallet. There we go. And then once you pull back, that gives us 2 sutures. So we're going to seat the anchor by pulling back on both sutures, making sure it's solid. And that looks very good. So here we're going to take one of the sutures we'll pull off the back, and now we're going to use the same techniques to pass the stitch and close down this space that you see right there. Here we are just getting ready to plan the stitch. We're going to come back, we're going to go into the capsule right about here. Okay, so there's our capsule, and then we're going to bring this underneath the labrum. About there. Now we're pulling back. You can see how it goes underneath the labrum and through the capsule. There we go. Now we're going to tie this knot just like that. So now we've got the second one tied. You can see how much less space there is at the bottom of your shoulder now. You see in the back how much tighter that is? Remember how we started, how wide open it was. So what I'm going to do next is, I'm going to close this posterior portal next. We're going to put a stitch in the posterior portal, which will be a number 1 PDS. I don't think we need another anterior anchor because there's really no more space. What we're looking, let me see the crochet hook twist. What we're looking at here is this is the middle glenohumeral ligament. Okay, and so that MGL has reasonable tension on it, and from the beginning we knew that that was okay. The subscapularis tendon is just to the left of it. The subscap is just right over here. That's the leading edge of the subscap that you see just behind the blue cannula as it goes down. I can back the blue cannula out a little bit. Yeah, so that's the leading edge of the subscapularis tendon. That's the most superior portion of the subscap. And so we hardly ever have to do any surgery to tighten things in this superior portion of the anterior shoulder there, which is why I think we're going to stop right there. That looks pretty good. But I am going to close the posterior portal just because of your instability being multi-directional. Okay, so this is how we're going to close the posterior portal. We're just going to take a spinal needle just like that. And we're going to pass a number 1 PDS suture right now. So I'm just going to stabilize the needle and pass that suture through so you'll see in just a minute. There it is. This is an absorbable stitch. Once you get enough there, we'll try and retrieve it here. So we placed one just to close the capsule. That little gap that's left there I think is small enough that we don't have to worry about it, but we've got that capsule where I think it won't propagate, so that looks good. So we're going to finish up here just to give you the overall look again. There's the front. It's much tighter. I don't see any big space. And in the back, remember we had that big space in the back before. Now we've got those 2 sutures tightening that and really reconstructing the posterior band of the IGL. So we're going to finish up here and get you back to the recovery room. Good luck to you now. Bye-bye.